Welcome to the Neurokrish Immersion. In this episode, we're going to talk about the wandering nerve, the vagus nerve, and how stimulating the vagus nerve is healing brain, body, and mind. The vagus nerve is called the Great Wanderer. It's the 10th cranial nerve, and it stretches from the brainstem through the chest to abdomen, and in this way it is the longest cranial nerve. We have 12 cranial nerves in our brain. It's also the only one to leave the brain and to have impact on the whole body. 80% of the vagus nerve are afferent fibers, which means that they take messages from the body to the brain. 20% are efferent fibers, which control our automatic or autonomic symptoms. The vagus nerve is a central regulator. It regulates your heart, gut, lungs, digestion, immune responses, and what we call the parasympathetic system. And therefore, our great wanderer, the vagus nerve, connects brain, body, and mind. It's an anatomical marvel which exists on the left and right side and extends from the brainstem through the chest to the abdomen. As I mentioned, it has predominantly nerves that carry messages back to your brain, and it has a range of regulatory functions. This really is your body's information superhighway, and it establishes that link between the brain and your organs. And if your brain knows what your heart or your gut or your lungs are doing, it's through the vagus nerve. Now, vagus nerve stimulation as a treatment for various neurological disorders emerged many years ago as a concept. But in 1997, the first FDA-approved device for treatment-resistant epilepsy was introduced by a company called Cyberonics, and this involved implanting a stimulator inside your chest wall and connecting it to the vagus nerve in your neck. Subsequently, vagus nerve stimulation has been tried and approved for depression, for migraine and cluster headaches, and today there's a growing interest in using it for obesity management. In this time frame, vagus nerve stimulation, the technology has morphed from invasive implants to sophisticated non-invasive devices, expanding treatment accessibility across multiple conditions. Now, how does stimulating your vagus nerve work? It modulates your neurotransmitters. It enhances the release of norepinephrine, serotonin, and dopamine, creating cascading effects through the nervous system. It activates your cholinergic anti-inflammatory pathway, reducing systemic inflammation and cytokine storms. It enhances neuroplasticity, promoting neural rewiring and recovery, particularly valuable in stroke rehabilitation and cognitive restoration. So TVNS, or transcutaneous auricular vagus nerve stimulation, harnesses therapeutic potential without surgery through complex brainstem circuitry. The norepinephrine pathway, when it's stimulated, it enhances your attention, memory formation, and suppresses seizures. When it enhances GABA, it increases inhibitory neurotransmission for seizure control and neural balance. When it enhances your serotonin, it regulates mood, sleep-wake cycles, and pain perception. And when it works through your nucleus tractus solitarius, which is a central command where all vagal information converges, it then distributes that information to various brain regions. So the therapeutic effects of vagus nerve stimulation are by tapping into the body-brain connection, and they emerge through intricate brainstem circuitry involving multiple neurotransmitter systems. And as a consequence, vagus nerve stimulation has very wide clinical applications. What you need to think about the vagus nerve pathway is as a critical neural highway which plays a crucial role across diverse neurological and physiological conditions. Vagus nerve stimulation creates a powerful cascade of neurological effects throughout the brain, targeting 4 critical neural centers that work together to regulate mood, stress response, overall well-being. And this sophisticated network represents the body's natural pathway to healing and resilience. The nucleus tractus solitarius, as I told you, is the primary relay station that receives and processes vagal signals. It serves as the gateway for therapeutic effects throughout the brain's regulatory networks. The locus ceruleus, on the other hand, is the brain's alarm system and attention center, which modulates arousal, vigilance, and stress responses through norepinephrine release. The dorsal raphe nucleus is the primary source of serotonin production, directly influencing mood regulation, sleep cycles, and emotional stability. And the paraventricular nucleus is the master controller of the stress response system, regulating cortisol release and maintaining homeostatic balance. We now put out with every one of our podcasts an infographic, and this I'm sure will have the image of these different nuclei in your brain. So please do download the infographic from the neurokrish.com website and you will feel more empowered with knowledge. Now, the vagus nerve provides us with 2 access points for transcutaneous stimulation, each offering distinct therapeutic advantages and anatomical characteristics. The auricular branch, the ear branch of the vagus nerve, innervates specific regions of the external ear, but which are called the cymba concha, tragus, and portions of the antihelix. Now, this branch represents primarily afferent sensory fibers that project directly to the nucleus tractus solitarius. So the information from your body is coming back to the brain through this information superhighway called the vagus nerve, and this is represented in your ear. So the key anatomical features is this connection with the nucleus tractus solitarius where this information highway converges, and this offers predominantly sensory pathway access, and it does give us an opportunity for precise anatomical targeting. On the other hand, the cervical branch, so the neck branch of the vagus nerve, is accessible and contains both afferent and efferent, that is, messages coming in and messages going out from the brain. And this provides us with broader therapeutic access, but it then requires precise electrode placement to avoid adverse effects. And of course, this particular type of vagus nerve stimulation is what is popular when people try to self-administer vagus nerve stimulation. But I'd like to give you a note of caution there that this can be deleterious, and it's very, very important to be very conscious that this is not some passive placebo effect. The vagus nerve is a very important part of your nervous system. It is your information superhighway. It does control your organ function like your heart function, your lung function, your kidney function, your gut function, and tampering with it without medical expertise can be having deleterious effects. And again, if you go to our infographic, I'm sure you'll find the visual of how these different branches work. Now in epilepsy, what the vagus nerve stimulation does is that it works on the hyperexcited neural network with imbalanced neurotransmission, which is what causes seizures. Seizures are your brain firing out of control. It enhances the inhibitory neurotransmitter, GABA, and this results in these abnormal brain signals being inhibited. It creates more integrated and resilient epileptic networks through fiber activation, and it modulates the balance of GABA and norepinephrine, and this provides therapeutic benefit. So this is how in epilepsy, vagus nerve stimulation helps to reduce the seizures, and we've had a very large number of people with frequent seizures, including children with frequent seizures, in whom this technique has been extremely helpful. Indeed, so helpful that it has even demonstrated to show the opposite of what happens when your seizures are too controlled. When your seizures are too well controlled, not only do seizures stop, we start having behavioral problems in some people. And this particular phenomenon is called forced normalization, where it is as if the control of seizures results in behaviors emerging, abnormal behaviors emerging. And this is something that I have written about extensively in the medical and scientific literature. And I'm very pleased to say that forced normalization is one example of how we test a treatment for epilepsy. And we've reported the first case of forced normalization with non-invasive vagus nerve stimulation, showing that it is actually an effective treatment. Now, one of the conditions in which our interest with vagus nerve stimulation is growing is dysautonomia and postural orthostatic tachycardia syndrome. We've talked about in other podcasts the dysregulated autonomic function that many people have, especially with long COVID, with excessive sympathetic activation and parasympathetic withdrawal. And what direct vagal activation causes is it enhances the cardiac parasympathetic tone, improving the heart rate variability and reducing excessive tachycardia. It also has the cholinergic anti-inflammatory pathway activation, which reduces systemic inflammation and autoantibody production against adrenergic receptors. And of course, it modulates the brainstem cardiovascular control centers, improving orthostatic tolerance. Vagus nerve stimulation has also become a treatment for headache. It modulates your pain pathways. What cluster headache, for example, is due to is dysfunction in the trigeminal, autonomic and hypothalamic circadian systems. And what trigeminal pain modulation does via the vagal pathways is it interacts with the trigeminal brain processing centers, it restores parasympathetic sympathetic balance, and it reduces autonomic symptoms. And of course, this results in modulation of your brainstem pain control mechanisms. So vagus nerve stimulation is useful for cluster headache. It's also useful for migraine, which is due to a complex neurovascular dysfunction involving cortical spreading depression, trigeminal activation, and sensitization. It modulates your cortical hyperexcitability and spreading depression. So indeed, cortical hyperexcitability is what we see in epilepsy, is what we see in migraine as well, and very often these two conditions go together. It inhibits the trigeminal pain pathways. The trigeminal nerve is the nerve that supplies the face, and facial pain often comes from trigeminal pain, and we call this trigeminal neuralgia. Interestingly, in both migraine and cluster headaches, trigeminal pain pathways have a role to play. And vagus nerve stimulation leads to a reduction of central sensitization through brainstem modulation. So vagus nerve stimulation also is known to enhance cognitive function, and it's becoming a treatment for people with memory and cognitive problems, those with mild cognitive impairment, conditions like Alzheimer's disease and vascular dementia. It enhances memory consolidation through facilitation of what's called long-term potentiation, which modulates your hippocampus, the synapses in your hippocampus. Please remember from my previous podcast, the hippocampus is your center of human memory. It's only the size of a finger joint, and it's a storehouse of all your memories. Functional MRI studies have shown that in people with implanted VNS devices, there's a demonstrable, measurable cerebral blood flow alteration within the brain regions, especially those involved in cognitive processing. So therefore, vagus nerve stimulation appears to have a growing importance in memory and cognitive enhancement as well. Successful clinical implementation of vagus nerve stimulation requires careful consideration of a number of patient-specific factors. And please remember that in centers like Buddhi Clinic, we do not stimulate the vagus without doing an ECG, without understanding the person's cardiovascular functioning, without knowing whether they have a slow or a fast heart rate. And these are important considerations before the vagus nerve stimulation is used as a treatment. And of course, we also are interested. Clinicians should therefore monitor treatment response carefully and adjust stimulation parameters as clinically indicated constantly. Most studies suggest that vagus nerve stimulation needs to go on for 2 to 3 months in order to show benefit, and some people may need long-term therapy for sustained effects. And indeed, many of the people who come to us in Buddhi Clinic do end up having, apart from the first cycle of treatment, booster cycles, which they need periodically in order to stay well. But it does work, and the important thing, of course, is for one to stay well. It's also important to remember that this is not a standalone treatment. Vagus nerve stimulation is an adjunctive treatment modality and needs to be integrated with standard medical management, and therefore it's not monotherapy. In the future, many considerations are there on how vagus nerve stimulation research needs to improve, because the research stands at a pivotal juncture. There is the possibility that we will develop very specific biomarkers, not just lab-related biomarkers, but also things like specific EEG patterns that can help us decide on whether vagus nerve stimulation is working well or not. We need to phenotype our patients better, characterize them into subgroups, and this needs to be done through comprehensive clinical and neurological profiling. And of course, we may need to refine our stimulation parameters like frequency, pulse width, and intensity. So this is really a growing space. But as we work with vagus nerve stimulation, we are beginning to understand the importance of the great wanderer and how it is the information superhighway for your brain, body, and mind. The transcutaneous approach has been a paradigm shift in the way that we are able to access the vagus nerve and work with patients. It's revolutionary, offering powerful therapeutic pathways without surgical intervention. The clear evidence exists today across epilepsy, dysautonomia, and headache disorders with optimized protocols. And this is a treatment with robust safety profile with a growing mechanistic understanding that positions vagus nerve stimulation as a crucial tool in modern neurology. The neurophysiological rationale involves sophisticated modulation of GABA, norepinephrine, and cholinergic systems through the brainstem pathways, and the multifaceted neural network modification that vagus nerve stimulation offers explains its broad therapeutic applications and suggests that it can expand into additional neurological and psychiatric conditions and how they can be treated. In a way, TVNS represents the future of neuromodulation, combining accessibility, efficacy, and safety in one transformative approach. Now, what happens in long COVID? There is autonomic dysregulation. Dysautonomia manifests as disrupted heart rate variability, blood pressure instability, and temperature regulation issues. People end up with things like voice and swallowing issues. Dysphonia and dysphagia reflect direct vagal nerve involvement, affecting laryngeal and pharyngeal function. So your throat and your voice box can be affected by the long COVID dysfunction, affecting the vagus nerve. Cardiovascular symptoms like palpitations, dizziness, and postural intolerance indicate compromised vagal control of cardiac function. Indeed, many of our patients complain of waking up in the morning, and when they get out of bed, they really feel bad. There's a lot of fatigue, there's dizziness, there's an inability to get up and go, and this lasts for many minutes, even hours, before the person starts to feel better. And this is fairly typical of dysautonomia. And it's a story we keep hearing all the time. It's pattern recognition that we've started to make over a period of time of working with these patients. And of course, there is GI upset. The gastrointestinal system is upset. There are both irritable bowels and or constipation. There's persistent fatigue, and all this comes from impaired vagal regulation of digestive processes and energy metabolism. Now, let's go back and think about the vagus nerve from ancient Indian science. We've all heard of the Kundalini, and we've all heard about raising the Kundalini. In yogic philosophy, the Kundalini is described as dormant, coiled energy at the base of the spine, what's called the Muladhara chakra. Through spiritual practice, this energy is awakened and ascends along the central channel and passing through the chakras and culminating in expanded consciousness. The chakras can be seen as metaphoric representations of autonomic plexus and endocrine glands along the spinal axis. So the Muladhara, which is the pelvic plexus and the adrenal medulla axis, the Swadhisthana, which is the sacral plexus, also affects the reproductive system. The Manipura, which is the solar plexus, has a sympathetic dominance and it affects the gut-brain axis. The Anahata, which is the cardiac plexus, has an impact on heart rate variability and balance. The Vishuddha, which is the cervical plexus, has vagal branches to the larynx and pharynx. The Ajna, which is the hypothalamic pituitary axis, is the autonomic command center. And the Sahasrara, which is cortical integration transcending autonomic control. Kundalini awakening experiences are often described with autonomic correlates: heat, sweating, tremors, altered breathing, sexual arousal, gut sensations, spontaneous postures. And if you think about it, this is the balance of sympathetic and parasympathetic activity being affected in some way. And yogic practices have a role to play in stabilizing autonomic tone. And in particular, pranayama and various forms of meditation have been described. So the rise of the Kundalini may correspond to a shift toward the parasympathetic dominance with an expanded window of autonomic flexibility, the ability to handle stress without losing inner calm. Indeed, our ancients were probably far more aware of the vagus nerve, even without knowing that it really existed or giving it a name. And the way that they described it in terms of the Kundalini matches with what we are discovering in science today. And I found that very, very interesting. Now let me discuss Mr. S, who came to us with dysautonomia and how we managed to work with him. A 52-year-old businessman experiencing the devastating aftermath of COVID-19 infection had continued cognitive challenges with debilitating fatigue, brain fog, memory lapses, and increasing irritability affecting his work performance. He had autonomic symptoms that we diagnosed. He had postural orthostatic tachycardia syndrome, and every time he stood up, he was dizzy and he suffered from very severe exercise intolerance. People with exercise intolerance find it very difficult to go on. That short bursts of activity can result in them feeling extremely fatigued and tired, needing to rest for prolonged periods of time before they are able to start working again. And this can be very, very disturbing to someone who is used to working in a certain way. And Mr. S also had persistent gut health issues, acid reflux, sleep disruption, anxiety, and an emerging depression because he was continuing to suffer with these symptoms. We put him through autonomic function testing, which confirmed his SPOTS diagnosis. And, we use the tilt table and we look at heart rate variability as one of the ways in which we are able to make a diagnosis. His neuropsychological evaluation documented anxiety, depression, and mild cognitive impairment despite having a normal EEG. And his comprehensive autonomic checklist revealed significant dysfunction with a score of 17 out of 30. Therefore, precision testing for him revealed profound autonomic dysfunction despite normal routine cardiac and neurological studies which he had already had. And indeed, this highlights to us the need for specialized evaluation for long COVID patients. How did we treat him? He received transcutaneous auricular vagus nerve stimulation, 20-minute sessions 4 times a week for neural rebalancing. He had cognitive interventions like CBT and cognitive retraining to address his anxiety and cognitive symptoms. He underwent physical rehabilitation, graded physiotherapy to improve his exercise tolerance and autonomic function, and we have very specific autonomic balancing exercises that we teach our patients. He underwent Ayurvedic and naturopathic processes for systemic balance and healing. He took to yoga, incorporating pranayama, chanting, and yoga nidra for nervous system regulation. And we did, of course, prescribe medication to him that restored autonomic balance. And this type of medication emerges from the anti-epileptic space. These are medicines that work through sodium and potassium channels, and they rewire the nervous system by balancing the flow of ions across channels. So he was given such medication as well. There was a complete transformation in Mr. S after 5 weeks. He experienced 70% reduction in his symptoms, with the dizziness, pain, and anxiety all coming down. He had an 85% improvement in his sleep quality, with his sleep architecture improving and his being able to experience restorative rest. And he had a 60% increase in his energy, with a notable boost in stamina, productivity, and overall vitality. Our integrative approach at Buddhi Clinic, therefore, successfully restored physiological equilibrium, demonstrating the power of combining modern medical interventions with traditional healing modalities. And just to remind you, here's a person who had medicine, here's a person which was allopathic, here's a person who took transcutaneous auricular vagus nerve stimulation. He underwent physiotherapy and psychotherapy, all of which are modern approaches to healing people, but he also went through Ayurveda, naturopathy, and yoga, which helped him. And this integrated approach is what we are constantly talking about in Buddhi Clinic. In reflection, therefore, the vagus nerve is your information superhighway and a central hub. The scientific evidence that we have confirms its pivotal role in brain-body communication and whole person health. Functional neurological disorders and post-viral syndromes respond remarkably well to vagal information, and please remember that long COVID symptoms and FND are greatly benefited by vagus nerve stimulation. The synergy that integrative medicine brings, combining pharmacotherapy, vagus nerve stimulation technology with yoga, Ayurveda, and other healing procedures, creates powerful healing synergies. And the case of Mr. S demonstrates how integrative care can successfully restore physiological equilibrium by addressing the sophisticated interplay between nervous system function, inflammation, and psychosocial well-being. And we do have an infographic that goes alongside our podcast, and this will give you some images that tell you about how the vagus nerve has connections with your heart and your lungs and your gut. And I invite you to explore the infographic. Now, vagus nerve stimulation through electrical impulses is what we are talking about today. But did you know that there are everyday practices for nervous system health that include vagus nerve stimulation that we have been doing for years? conscious breathing, part of a lot of meditation practices or indeed yogic practices, has an impact on your vagus nerve. Vibrational practices like humming, chanting, and vocal toning create therapeutic vibrations through the vagus nerve. Yoga, meditation, and therapeutic massage integrate your mind and body and enhance vagus tone naturally. And exposure to cold, brief cold immersion stimulates vagal responses and builds resilience. And you can think of all our saints and sages who immerse themselves in the cold waters of the Ganges and view that as a very important part of how they start their day. These practices remarkably overlap with ancient Kundalini traditions, suggesting timeless wisdom about nervous system regulation. So, integrative medicine brings together modern medicine, traditional systems, and this pluralism in healthcare recognizes that different healing paradigms serve complementary roles in restoring health and preventing disease. I call this the McDonald's paradigm, the way in which we balance choice and clinical guidance as part of integrative healthcare. For mild impairments and mild chronic symptoms, patient choice becomes extremely important because it empowers people with options and education. For people with chronic or severe symptoms and disease states and for rehabilitation, we need evidence-based treatment protocols which are guided by the doctor. Now, this is no different from our journey in McDonald's. You can go in and say, I want a burger, I want a fries, I want a Coke. Or indeed, you can take the Mac meal that they curate for you. The former is you making a choice. The latter is guided choice. And indeed, guided choice is a very important aspect of integrative healthcare. It balances patient autonomy with clinical expertise, adapting the therapeutic approach to severity and complexity of each condition. At Buddhi Clinic, we work with people with preventive health needs in whom patient choice is very important. We also work with people with severe disabling neurological, psychiatric, and orthopedic conditions. And here, guided choice and being able to offer people that Mac meal is very important. And that's the balance that I would like every one of you to keep in mind. As we come to the end of this episode of the Neurokrish Immersion, I would like to draw your attention to the two previous episodes, one in which we talked about the promise of integrative medicine, the other in which we talked about the interpretation of an unexplained malady. This episode on the vagus nerve integrates a lot of that knowledge and brings together the current practice that can help us overcome difficult to manage symptoms. If you like this podcast, please subscribe and share. You can follow us on Apple, Spotify, and YouTube. Thank you for your patient listening.